Susan from Reading asks, I am a 10-year survivor of breast cancer. Do I still need to continue to follow up with my oncologist?
That's a very good question. I personally, at 10 years, I don't necessarily see the need for follow-up with me. Most of the sequela from if you receive chemotherapy, most of the long-term side effects you may receive have either come to fruition or we've had touched upon or haven't come to fruition. Most of your follow-up at that point, at the 10-year mark, is something that your primary care physician will gladly take over and assume that role. So for my personal practice, at 10 years, I usually tell people they don't need to follow up with me. If they want to, I'm perfectly happy to do so. But if not, their primary care can usually do most of the follow-up for the cancer at that point.
We have another question. My paternal cousin is a 55-year-old man who was recently diagnosed with breast cancer. I am surprised. Do men get breast cancer? A neighbor says he might need a genetic test. Is that true?
The question is a 55-year-old gentleman who was diagnosed with breast cancer. Breast cancer in men is about 1% of all breast cancers. And it is, obviously 1% is a very low percentage. It is something, though, that does occur. And normally we treat male breast cancers the same as we treat, female breast cancers. The one thing that, though, that is important with respect to male breast cancers is that they do undergo genetic testing. Because of the relatively rare incidence of it, the low incidence of it, most men, and it is an NCCN, which is kind of almost like a regulatory body, they recommend that men who have breast cancer undergo genetic testing, not necessarily even so much for themselves, but for their family members, their siblings, and their children.
Meg, also from Reading, asks, when should a woman start having a mammogram? Wasn't there a controversy about this last year?
There is controversy, and the problem is there's always controversy about mammograms. Part of the problem is the federal government, the Institutes of Medicine, the American Cancer Society, everyone has their own guidelines in general. Typically there's a baseline done, sometimes at the age of 40, sometimes the age of 45. Usually by the time you're 50, yearly mammograms are recommended, and most of the recommending bodies do recommend them at that point, yearly at the age of 50. But baselines should be obtained prior to that, and I think that's part of where some of the controversy comes in. 40 to 45, there should be a baseline performed, and then follow up after that on a yearly basis. Now, if there is a lump palpated, if there's something felt on breast exam, then clearly mammogram is indicated right off the bat. And that may require more frequent follow-up. In women who have family members with breast cancer, okay, their mammograms may be pushed up earlier to 35. Again, it depends on certain situational factors that everyone needs to take into account on an individual basis.
Anne from Virginville writes, what difference does it make if I have a genetic test for the BRCA1 and BRCA2 genes? How will the test results affect my life, and what might I have to do to decrease my risk?
Well, BRCA1 and BRCA2 are genetic occurrences that do predict a higher incidence of recurring breast cancer. So in someone who has breast cancer and they are found to be BRCA1 or BRCA2 positive, there are two effects it may have. One, it can have effects on your family. So your siblings, your children, they will need to, this information is critical for them. So that's one issue. The other issue is to what degree it'll affect you. Well, if you are BRCA1 or BRCA2, you may want to consider a bilateral mastectomy. Some women do. Some women consider that they don't want that, but they want more frequent monitoring, want more frequent mammograms, decide to get MRIs, then alternate MRIs with mammograms. So it does, your surveillance is very dependent upon, well, on the results of those tests in that way. Now, deciding whether you should receive the test is something that should be done in conjunction with the genetic counselor. There are certain very hard criteria. For example, women under the age of 50 absolutely should have genetic testing done. Men should absolutely have genetic testing done. Beyond that, though, a lot of it, there are some issues with, there are some indications depending upon your family history. So if you've had two aunts and your mom had breast cancer and they were relatively young, well, I think that's something that you really need to consider very strongly. In addition to that, having those BRCA1 and BRCA2 positive genes involved also puts you at higher risk, for example, ovarian cancer, BRCA2, pancreas cancer. There's a link between the BRCA genes and prostate cancer in men. So there are a lot of other issues that need to be evaluated. So it does have a big impact on your life, even if you were to say have the breast cancer removed and you're all done with that aspect of it. Not necessarily. There are other things that have to be involved that we have to take into consideration.
And our final question, doctor, are there other cancers that are related to breast cancer?
As like I just mentioned, prostate cancer can be related, endometrial cancer can be related, ovarian cancer can be related, pancreas cancer can be related. So there are definitely some genetic links, sarcomas, lymphomas. So there are definitely some genetic links that we need to be aware of and that you as patients need to be aware of if you are diagnosed with any of these genetically related breast cancers, BRCA1 or BRCA2.